name is Lauren Troberg. I'm going to be a student physical therapist today working with you. How are you doing?
I'm good. How are you?
Doing pretty well. So I hear that you're having some pain, tenderness, and clicking on the pinky side of your wrist when you're playing baseball?
Yeah, it hurts when I go up to bat and hit the ball.
Okay. Well, looking at your MRI, it looks like the doctor indicated that you have a tear in your triangular fibrocartilage complex. Does this sound familiar to you?
Yeah, it sounds about right. I just don't remember a whole lot about the injury and what's going on.
Okay, so what the TFCC is, it's a load-bearing structure that is in between the lunate and triquetrum, which are two carpal bones in your wrist. It's also between the ulnar head, which is the long skinny bone on the pinky side of your wrist. It's made up of a fibrocartilage disc, some ligaments, meniscal tissue, and the extensor carpi ulnaris tendon, which is a muscle in your forearm that allows you to extend and ulnar deviate your wrist. The TFCC is an important stabilizer in the wrist. This muscle is commonly injured in baseball players because of the load that you put through the wrist when you're swinging. So when you go up to bat to swing, you have to ulnar deviate the wrist, which puts a lot of stress through that complex. Does that make sense?
Yeah, that makes sense.
So the good news with this prognosis is that it's generally favorable. However, the treatment plan for it for the beginning is to rest. So I'm going to need you to take some time off of hitting practice. Do you think you can make that manage?
Yeah, I think I could do that.
Okay. So today I'm going to be giving you some handouts that will show you where you can buy a splint, where you can immobilize the wrist so that it can rest and heal. I'm also going to teach you how to ice the area to decrease any inflammation and alleviate any pain. Do you have a good ice pack at home?
Yeah, I do actually.
Perfect, we're going to need that. So in a couple weeks, I'll have you come back to therapy and we're going to start working on regaining your range of motion in your wrist, fingers, and thumb. And once we regain that range of motion, we're going to switch our focus to strength training, and we'll do activities such as TheraBand workouts, dumbbells, TheraPutty, weight-bearing activities, stuff like that. Does that sound like a plan?
Yeah, it sounds good.
Perfect. So just to recap, it's very important that you take it easy for a while to let that complex heal. And then again, when you come back to therapy, we're going to work on any limitations in your range of motion and strength, as well as I want to look at your hitting swing to see if we can modify it at all to decrease the stress throughout that TFCC.
Okay.
All right, do you have any questions for me?
Not at this time, but I'm sure I will in the future here during our sessions.
Okay, I'm just going to grab a couple handouts and then we can begin.
All right.
All right.